Hi. Hi, everyone. Just waiting a minute or two. Let me know if you can hear me. Happy Friday, everyone. Great. Thank you. Hi.
Hello,
Hi. Hello, hello.
salam. Hello, Baharjan.
Hi, Salam. How are
Good morning,
you?
work.
Good to
Good.
meet you.
Happy Friday. Nice to meet
Thank
you.
you.
We're
Finally,
finally getting a
after
Persian connection.
after after a few years,
I
back and
know.
forth.
I have been following your account for a long time. I think we've been following each other, and we've been wanting to do
Yes,
this live, and it's
I
finally working out. So I'm very happy.
know. I know. It's great. So, how are you?
I am very well. I
Busy,
am here.
busy.
I'm here in sunny Florida. You're in Canada, is
Yes,
that correct?
yes. And for a change here, we have sunshine too, and it's warm and nice.
That's lovely. You gotta cherish that
Yes,
when you can. When I
exactly.
know that you were in Florida a few weeks ago, and
Yes, a few
we were hoping,
times.
yes, we were hoping to meet up, but I didn't make it to the conference that you went to. And we chatted, and we're doing this live because I was gonna ask you all these questions of what you took away from the conference, what you learned, what were the takeaways that you felt like were just not to be missed. And you said there was so much that you didn't even
Ooh,
like couldn't even summarize it. But
I
I think
know.
I chose just a few lectures that I felt were women's health related, and we were just going to chat about it. I think there was one that I was very interested in, the one about the femtech, where she was talking about prolonging the ovarian function and how to delay
Yeah.
menopause. Did you make it to that one?
I did. I
Yeah.
saw a little bit. I listened a little bit. It's just mind-blowing, amazing talks. It's just, I always say it's a great time to practice medicine, longevity, and
Yeah.
anti-aging is
Yeah.
beautiful times, but it's even better for people who want to be proactive and take charge of their health. So with
Hmm.
all the advancements in hormones as an anti-aging,
Yeah.
and peptides. So a lot of talk was about peptides, about
Hmm.
hormones, especially for women, and also about AI. So we talk
Hmm.
a lot about AI and
Yeah.
AI technology, which
Hmm. Uh-oh. Sorry.
are we good?
Yeah, I don't know if it's my sorry. The vi the Wi-Fi here is like third world here, but okay. Yeah,
Yes,
you were
so
saying
yeah,
the
I heard some of the talks from Dr. Garrison. So it was very interesting. So she was saying, talking about how interesting is that women uh, have a longer lifespan, but they have a shorter health span
healthspan.
compared to men. And
Mm-hmm.
that is mainly because of early retirement of ovaries and loss
Mm-hmm.
of hormones that
Mm-hmm.
has like a domino effect and can just affect so many different
Yeah.
organs. So it's not just reproduction and
Mm-hmm.
fertility, but it's all about other important effects of these hormones from ovaries that when it's gone, then there's so many women do poorly without these
Yes.
hormones. So,
Mm-hmm.
so she talked a lot, and then reminded us how, with so many numbers, that how these studies, there's so, not many studies for
Yeah.
women. So
Yeah.
focused on women and how we have to increase these studies and investment for women's health. and some numbers that I can tell you about, even FDA approved drugs. So last 15 years out of 623, I found it interesting to know, that's sad, just 43 of these medications targeted female specific conditions. So this
Mm-hmm.
is not good in this day and age. We should do better. Women
Mm-hmm.
are not little men, so we need to have more studies. And then yes, so it's about the ovaries and the connection of ovaries with all other organs.
Mm-hmm.
So it's
Mm-hmm.
very interesting. So we don't know so many things still. We don't know. So we
Yeah.
need the research. We need the
Yes.
study to know how this affects. And then from the other side, it was very interesting talk of Dr. Raphael
Yeah. Oh,
about
yeah. The
again hormones.
glycanage. Yes.
Yes, glycan
Mm-hmm.
age, and
Mm-hmm.
how these hormones, especially estrogen or estradiol and testosterone in men, can reduce that inflammation and can reduce that glycan age. So he did this study, which is very interesting, and we can measure glycan age with a special blood test.
Mm-hmm.
So again, it's all about how to stay not only long life, to have a long life, but a
Mm-hmm.
healthy. That is
Healthy
more
life.
important, a
Healthy life.
healthy.
Correct.
Yes, very
Did
interesting.
did you get to see the lecture where the doctor, and I forgot the physician's name, but she was talking about how you can remove part of the ovary and then store it, and then you could re-implant it and help people preserve ovarian function and delay menopause?
No,
Yeah,
so that will be probably our next talk. I will have a
yeah.
look at that and then we will have another short live to talk about that. Yes, which
Yes.
is very
I
interesting.
think I think it will be interesting because we know that, for example, younger women who undergo chemotherapy,
Hmm.
we can freeze their eggs to preserve some of their ovarian function that way. But she was talking about, instead of just freezing eggs or freezing an embryo, you can actually just take a piece of the ovary out through a
Hmm.
surgery,
Hmm.
and then you probably cryofreeze it. I don't know how they store it. I didn't attend that lecture. I just heard of her and what she does. And it's still like in research stages, but they can then re-implant that part of that ovary, and then you would restore ovarian function again. So if someone
Hmm.
was in late perimenopause, menopause, by getting some of their own follicles back, they could delay the onset of menopause. I thought that was interesting. So obviously pretty invasive if you were to do
It
that
is.
just for menopause purposes, not for fertility. It's kind of like it's two procedures. I don't know if you need a laparoscopy every time. Would be
Hmm.
interesting. But I found that interesting because previously at A4M, obviously they have talked about the rapamycin study where they're using a medication that we usually use as an immune suppressant
Hmm.
for a transplant patient, but now it has been discovered, in the last few years for its anti-aging purposes because it suppresses mTOR. And if you use it in smaller doses than you use it as an immune suppressant, you can possibly slow down aging. And there's a study with that and ovarian rejuvenation or preservation of ovarian function. And that study, I think, is still ongoing. But I've listened to that lecture at A4M before, but I haven't seen that other lecture with the
Yes.
ovarian cortex being cut out. I thought that would be interesting to know. Now, I think there was a talk about, I don't know if you get to see that one, Maharjan, about uh, gut microbiome and hormones as well. Did you
Again,
get
a
to?
lot of talk, a lot of
Mhm.
focus on gut, gut health, and how important they are in hormone metabolism. Yes,
Mhm.
Dr. Lovell, for example, she did a
Mhm.
great talk about how gut dysbiosis or imbalance
Mhm.
of these microbiomes can
Yeah.
affect little bacteria in our gut, can impact hormone metabolization,
Mhm.
and that is so it's important, very important to look after our gut
Mhm.
health either by supplements or
Yeah.
very more important with your sleep, again
Mhm.
going through the lifestyle, diet,
Yeah.
stress. So all of those can impact gut microbiome, and that in return can impact our hormones.
Mhm.
So these little, some of these bacteria, which is called estrobolome, so
Mhm.
these little bacteria can produce an enzyme,
Mm-hmm.
beta-glucuronidase. That
Mm-hmm.
this enzyme has an important impact on our estrogen. So when estrogen goes to liver and there become changes, little happens in the liver, then goes to kidneys and our gut. So in gut, this beta-glucuronidase can impact and return of estrogen to our system or circulation. So to some extent, it's good for us to keep our hormones, but not
Yeah.
over an excess that then
Yeah.
could cause so many other problems. We want
Mm-hmm.
to get rid of the excess estrogen, and when it's not happening because of that dysbiosis, that could be some other issues caused, for example, estrogen dominance and other
Mm-hmm.
old symptoms of estrogen dominance. So
Yes.
that's why important, not only gut microbiome is so important in other things like our immune system, but
Mm-hmm.
even our hormones, hormone
Yeah.
balance. So that
Yeah.
was an amazing talk, very insightful and informative.
Yeah, I would like to simplify it for people who want to understand this better. So I always tell it to my patients because I run gut testing when I can. I don't run it on
Mhm,
everyone, but I do it a lot
mhm,
because I like to measure the beta glucuronidase activity for that reason. What I like to say is this: your gut can decide if you're going to retain a lot of estrogen or you're going to excrete a lot of estrogen. If you're given antibiotics and it affects your gut microbiome, it kills
mhm.
your bacteria off, you're actually going to lose more estrogen. If you are constipated, you are going to retain more estrogen. So you want to always be very, very clear about your gut function and how that,
Mhm.
affects your estrogen levels and the metabolism, those metabolites that are in the gut and metabolize, you kind of want to get rid of them. You want to excrete them. So you don't want the
Mhm.
bad stuff back, but you want some estrogen recirculated and in times of
Yeah,
need when you're low in estrogen. And this gut microbiome is so fascinating because in perimenopausal stages, when women are running sometimes low on estrogen, it can help you cleave some back and bring it back into the system. So it has a really positive function as well. It's not just negative because often they come to me from naturopaths or like, other people and they're always on calcium deglucarate to counteract that beta glucuronidase. And I say you don't always want to do that. Sometimes you might want to actually it's a reaction to the estrogen not being adequate. So
exactly.
I think overall what people just need to understand is your body works in a system. It's interconnected as a whole system. And what you do to your liver, whether you are eating a lot of processed foods or sugary foods, or if you drink alcohol, that's going to affect your hormone
Mhm.
metabolism. And what you do to your gut is going to affect your hormone metabolism. So just being aware of that can be very helpful and maybe motivate people to want to be healthier with their lifestyle too, because then they
Yes.
kind of understand it affects their hormones as well.
And exactly as you said, not everyone need to get tested, but we see more and more, especially
Mm-hmm.
women going through the change during
Mm-hmm.
perimenopause and menopause, that gut health issues. I see a lot of women with
Yeah.
bloating, gas, indigestion symptoms, constipation, or IBS symptoms. So that is very common. So this hormone and gut microbiome so much into
Yeah.
linking to each other. So it's very
Yeah.
important to know. Sometimes we have to do some tests to figure out.
Yes,
So do
absolutely.
you do those tests? Do you do some
Yeah, we,
tests?
we run them. I
Functional.
don't know how open people in the patients in Canada are to like
Mm-hmm.
functional testing. I asked because, I know back in Austria, like I tried to run a test for my, where I grew up in Austria, where my brother's girlfriend was. She wanted me to order a test. We had such a hard time finding that gut microbiome test in Austria. She had to order it through a lab in Germany. But here in
Wow.
the US, not only do you have one, you have like 1,000. You have a plethora of tests to choose from.
Exactly.
And
Yes.
I think it's so accepted by people, by patients, that it is an important part. I think people
Mm-hmm.
understand it and they're very willing to get that testing run. Yeah. But insurance doesn't cover it in most of the time. So it's an out-of-pocket cost. So
It is.
you have to make sure that it makes sense to the patient and that they do see some benefits.
Yes.
I will tell you, a lot of the times I'll try addressing things without the testing to save costs, but I have had amazing results when I did the testing and I could
Yes,
direct certain things for people. And especially they love doing it and then repeating it in 6 to 12 months and
exactly.
do see the positive changes. I think that can motivate people as well, behaviorally.
It is very
Yeah.
good. I always say
Mhm.
test it and not guess it. So it's good to
Exactly.
test it, but again, we have to treat people and not the numbers only. So it has to be
Yes.
balanced.
Absolutely, absolutely. How is it with lab testing for you? Do you like checking hormone levels when you put them on
Yes.
HRT? Mm-hmm.
Yes, I
Good.
always do, and I love Dutch tests. One of my favorite tests because we do check many tests, especially women and men like to
Mm-hmm.
see their cortisol graphs. So that's very
Mm-hmm.
amazing test. So I always have that Dutch test. I mean, there are saliva tests for cortisol too, but I still prefer my Dutch test.
Yeah. Do you? That's great. That's great. You guys have access to that. I know in Canada, I think that is kind of like worldwide. I know people in Australia can
Probably.
run Dutch. That's pretty cool. They're very, very widely accepted. That's great. And then, do you like with Canada? So in Canada, do you guys have access to compounding pharmacies, or do you use just regular pharmacies for your
Yes, so we
HRT?
do have
Yeah.
compounding
Okay.
pharmacies, and I do order quite a bit from compounding
Nice.
pharmacy. So it all depends on patients' choices and
Mm-hmm.
needs. Some cases,
Mm-hmm.
especially if women are more sensitive, they prefer to have compounded base hormones. So or
Mm-hmm.
testosterone, I always go with compound testosterone. We still not have FDA approved, and for women. So we go compound through compound. But
Yeah.
I, of course, I always say look for a right pharmacy, find the right pharmacy, go and check and make sure the facility, everything is good. And
Yeah.
then, and I like, and I know my pharmacy and I order through them always.
That's great. And you can order, so can you see patients all across Canada, or is your license like ours where we're state by state?
Exactly.
Yeah.
So we have, at the moment, I just can see patients in Ontario and BC. So I
Okay.
cover these two provinces.
Okay. Okay.
Yes,
So you
and
have the
but
court.
again, for the tests, functional labs,
Uh-huh.
mainly it's through the states. All
Okay.
those different Genova or
Mm-hmm.
Doctor's Data, so all of the
Yeah.
American. We don't have here in Canada any of these tests.
Great. That's interesting. It's just there's just some slight differences there for sure. Do you think you're gonna go back to A4M next year? Do you feel like it was worth it? Did you learn a
Definitely. I
lot?
love it.
Yeah.
It's just not only about learning and listening to its beautiful talks, all these
Mm-hmm.
latest research and studies,
Yeah.
but connecting with others, like-minded
Yeah.
people is just great. So much insightful stories and info. It's great.
That's great. And I think you also went to Dr. Gilla's event, and I
Yes, yes,
I
yes.
hadn't heard of her before that event, and someone told me because a friend of mine was speaking on stage, and then it's funny because she's Persian too, and I had no idea. So we have that Persian
Yes,
connection.
yes,
Yes.
Dr. Gila. Yes.
Mm-hmm.
So I actually again connected through Insta
Mm-hmm.
with her too. So this is great. The social media is a beautiful place
Yes.
to get connected with you, all of you. So it's great.
Yeah, it's great. We get to exchange a
Yes,
lot. Well, we should probably do a follow-up because I think there was a few
definitely.
other lectures you wanted to kind of read about more.
Yes.
But the
Hmm.
main takeaways are you love, the idea of the gut microbiome, the importance of
Yes.
it. You like this testing of glycanage, which is going to be a marker for
Mhm.
cellular aging, but then also showing how using HRT in men and women can actually slow
Yes.
down that cellular aging. You also liked did you also get to do the talk? I think there was another one about genetics and hormones or women's health. Did you get to see that one?
No, no, not
Okay,
that
you
one.
might. I
Again, a
can.
lot of talk on it was about cardiovascular health
Yeah,
and
yeah,
prevention. It was interesting, Dr. Khan, who's saying how we have screening tests for breast cancer or colon
yeah.
cancer and PAP for cervical cancer. We still not have any screening tests for cardiovascular health, which is number one killer in the world.
Yes, and
Yeah.
what we have, it comes always with a little cost, or it might not get the full picture. And the heavy dyes for the angiogram, it's kind of a little
Hmm.
bit like a lot of contrast. With the
Exactly.
coronary calcium scan, you kind of look at the calcified plaque, but not at the soft plaque. And then you have maybe the carotid intima media thickness. Yeah, but will that give you the full picture of the microvascular, disease? And we know that women have a lot of microvascular disease, not so much
Yeah.
macrovascular.
Yeah.
So it's like, what would that screening be? And is it going to be just like a lab marker? And then when we
Mm.
use lab markers, we have the lipid markers and insulin and, those metabolic markers. But
Mm.
how much do they translate into directly into that risk for people, right? So
Yeah.
we would be great to have even more. I believe that in 5 to 10 years there will be even more precision medicine, even more
Definitely.
prevention, and
Yes.
for women specific, right? Women specific
Yes.
markers testing. It's a
Exactly.
very exciting time to
It
be to be
is, it
to be in
is,
this
and
space.
I definitely
Yes,
encourage everyone, public, general public, to just try to learn about all these things. It's
yes,
important. Empower yourself and talk to your doctors about all these. If you have questions, it's good to bring up that discussion, especially
yes.
about hormones,
And
especially about cardiovascular health. So you want to be proactive and not reactive. Don't wait for the disease to strike. I always say,
yes,
yeah.
yes, preach, preach. Well, I hope you enjoy your weekend with your family. We make this life
Yes.
work. I'm very proud of us. And hopefully we get to chat again. I would love to see you also in
Yes.
person,
It was
obviously.
great chatting to you,
Yes,
and soon we come back.
yes. Khudafis. Bye bye.
Bye bye. Khodafis. Bye.